Hi guys, I'm Dr. Tara Tobias, neurologic physical therapist here in Orlando, Florida. I want to welcome you all back to my channel. In today's home exercise tutorial, we're going to go over something that is super duper important, a lot of you, and that is stairs. So I get this question and comment a lot, is how to go up and down stairs and how to go up and down a curb step. I'm going to show you a few of the most common techniques, but with any type of neurologic injury, and this is the best part of my job or the best part of what I do, you really need to think outside the box. So again, I'm just selecting the ones that work for the majority of people. These are not the only techniques that you can use. If you're having trouble with this and one of these strategies don't work, I highly recommend working with a physical therapist just once or twice so they can look at your movement patterns and the specific movement problems that you're having and design a technique that will work for you. I have also listened to you guys and I have done what you've asked and I've tagged the involved leg. I'm not super happy with it because I don't like the way it looks, but I hear you. I know it's a problem. So I'm still trying to come up with a better way, but the way I've done it for this video is I've just put some duct tape on my leg and on my arm. So let's just go ahead and dive right in. So there's a few different scenarios that can come up when you're going up and down stairs. In this first scenario, we're gonna say that you have a handrail on both sides. That is best case scenario because you can always keep the handrail on your uninvolved side so that you can use your arm pretty easily. Let me go ahead and show you what this looks like. So with going up the stairs and the handrail on the uninvolved side, you're gonna step up with your strong leg. The way that a lot of people like to remember this, and I think a patient actually taught me this years ago, is that the good go up and the bad go down. So every time you go upstairs, you're gonna lead with your stronger leg. Some people are a little bit confused by that, but it's really your strong leg that pulls you up to the next step. So that's why you wanna put that foot up onto the next step first. And then with the handrail on your uninvolved side, you can use your arm to not only balance yourself, but also to pull you up to the step just a little bit. And same thing, we call this marking time. So you're gonna do kind of like what we call like a step 2 gait pattern. So step 2 stepping pattern, stepping 1 foot on each step and stepping kind of like step over step. That is extremely hard. And you're most likely not going to maintain good form. I would stick with this movement pattern until you have pretty good control in your uninvolved leg. And then coming down, again, most ideal circumstance is that there's a rail on the other side. And you can hold on to that rail again on your uninvolved side. You're going to lead with the bad leg. Remember, the good go up and the bad go down. So you're gonna lead with your bad leg. And again, some people question this and have a problem with this, but if you think about it, your strong leg is lowering your body down to that next step. So the stronger leg would be the one that you'd want to keep on the higher step as you do this. And again, we're just going to do that marking time, or that step 2. Every step you're going to lead with your involved leg, holding onto the rail, not only for balance again, but also to kind of take some of the weight off of those legs. You can lean on it a little bit in most cases, and then step together, step down, and step together. So let's say you don't have this ideal circumstance where you have a rail on both sides, and let's say you only have one rail on the uninvolved side. So going up is going to be easy. You're going to use the same exact technique to go up. You've got the rail on your strong side, so you can hold on to the rail with your strong arm, and you're gonna lead with your strong leg again and just do that same step 2. But then what do you do when you come down? So now you're turned around and you have a rail on your weaker side. And this is not the only technique, but this is the one that I find that most people use and that they find the most helpful. Is you are just gonna go backwards. So that means that you can hold on to that rail while you're coming down, and you're going to again lead with your weaker leg first, hold on to that rail, and then step your strong leg down. Lead with that weaker leg first, and then step down with your strong leg, and just keep going in this manner. So now let's say that the rail is only on your involved side when you're going up. So if this is your situation, you are just gonna go sideways. So you're still gonna be able to lead with your strong leg going up the stairs, but because that rail is on your weaker side, you're just gonna turn and face the rail, and again, lead with that strong leg going up. Just make sure that when you step that foot up, that you're stepping it onto the step far enough away from the edge that you can step your other foot up next to it. And then coming down, again, you can go sideways just the same way you went up, but really now it's on your uninvolved side, which is the technique that I showed first. And so again, you just lead with your weaker leg and you do that step two, step together as you come down the stairs. If there is not a rail and you still have pretty poor balance, I would not do this next technique. But what I'm gonna show you is how to go up and down stairs with an assistive device, so with a cane. I'm using what they call a quad cane here. This is great for stairs because it's a little bit more stable than a straight cane. And then what you're gonna do is you're gonna put the cane up onto the step first, then step up with your strong leg, then step up with your weak leg. Again, I don't recommend the step over step technique. I recommend the step two technique. And then you're gonna set it up on the next step and do the same thing. Step up with your strong leg and then your weak leg, and just keep on going. And then when you come down the steps, I find that most people feel a little bit more secure and a little bit more stable if they turn sideways just slightly, maybe almost at like a 45-degree angle. It's pretty scary to be staring straight down those stairs, and it really does take a lot of control. That's why I say, like, don't do this unless you have really good balance if you don't have a rail. But for those people that are a little bit higher level and feel like their balance is a little bit better, going down steps and slowing your body down, not only is it scary to look down an entire flight of stairs, but it does require like a lot of control in that leg, like I'd said earlier. So turning a little bit to the side, stepping down with your weaker leg first. And here's a critical thing that you want to think about at this point. When you go to bring that involved leg down, there's going to be a moment where all your weight's on your involved leg. So be ready with that cane to actually use it. It's going to be supporting some of your body weight. You really want to make sure that all four of those prongs are flat on the ground and that you really have a stable support with that cane, and then step your stronger leg down. So don't forget, there's going to be that moment where a lot of your weight is going to be on that uninvolved leg, and be ready for that, and then just step down. So, and then last, I'm going to show going up and down a curb step, just because some of you have asked for this. It's really very similar to stairs. So if you can use the technique that I showed with going up and down stairs with an assistive device, it's very similar. But again, you're literally just gonna set the cane up on the step first when you're going up. You're gonna step your strong leg up first. Remember, the good go up and the bad go down. Strong leg up first, and then follow with your weaker leg. The important thing here, especially if you don't have a railing, so if it truly is like stepping up onto a sidewalk and you don't have a railing, is a big thing that usually happens is once you get your strong leg up there, when you bring your weaker leg up there, that foot gets caught on the step. So really be ready for that and anticipate that that might happen, and be ready with that cane to help support you, but really kind of overemphasize lifting that leg up so that you don't catch your toe on that step as you bring that leg up. And then coming down, I like this little like 45-degree turn. I think it's very daunting to be looking straight down that step, and it's a little bit easier to control. You can keep a little bit more weight on the cane if you just turn a little bit to the side, step your weak leg down first, and then follow with your strong leg. The only thing when you do this little 45-degree angle, you just have to make sure that your foot is, when you set it down, it's far enough away from the step or the curb that you have room to set your uninvolved leg down. So I hope you guys found that helpful. If you like these videos going through like what I call like functional mobility skills, I haven't done a lot of these, but I'll definitely do more. Give this a thumbs up. There's a lot of other videos that I can think of where you might need some additional help. So getting in and out of bed, getting in and out of a shower. There's a lot of other things that you need to navigate, and I would be happy to add videos if this is something that you guys want. As usual, if you haven't subscribed, go ahead and hit that subscribe button. While you're there, hit that notification bell. Please leave comments, questions, concerns. They definitely help me out to know what you guys are having trouble with and what I can help you out with. Now, if you found this video helpful, congratulate yourself, because you are making progress. If you're at a point where you're thinking about how you're going to go up and down stairs or up and down a curb, those are things like community mobility type skills. So you are definitely making progress. Pat yourself on the back. I congratulate you. You take a moment to stop and congratulate yourself and just keep working on that 1% better. And I thank you all so much for watching, and I look forward to seeing you in the next video. You all have a great day.